In lip repositioning surgery, success is not just about cutting tissue. It comes down to one thing: how precisely the laser behaves in a very small, very sensitive surgical field. And this is exactly where the difference between CO₂ laser systems becomes clear. Hello everyone, this is Raymond Lee from Raymond's Dental Solutions. In this video, we are going to explore why a 2025 lip repositioning study strongly supports the clinical advantages of the Yoshida CO₂ laser. Because once you understand the science, you begin to see that not all CO₂ lasers perform the same. Lip repositioning surgery is essentially a game of millimeters. Symmetry and smile line balance depend entirely on how clean and precise the mucosal margin is. This is where the Yoshida advantage becomes very clear. With its 0.15 millimeter focal spot, Yoshida allows for surgical grade incision depth, extremely sharp margins. When compared to wider spot systems such as light scalpel, a larger spot size can create unnecessary thermal spread, and that can lead to less predictable healing in thin vestibular tissue. Clinically, this level of precision helps preserve tissue integrity, which means the aesthetic outcome reflects your intention, not the limitation of the laser. The 2025 study emphasizes the importance of visibility, but in real clinical situations, especially in the vestibule, blood can easily interfere with the visualization. This creates a very practical problem. For example, systems that use in a red guiding beam can become difficult to see when even minor bleeding occurs. In contrast, Yoshida's green guiding beam provides a much higher contrast. It remains clearly visible even in a blood-rich surgical field. This allows the clinician to track the intended surgical path continuously, avoid hesitation, maintain flow during the procedure, and in surgery, better visibility directly translates into greater confidence. Another important factor is beam stability. In lip repositioning, the incision is often long and curved. That means the laser must maintain consistent energy delivery at different angles. With a fiber-based system, internal reflection and bending can lead to spot enlargement, less defined margins. Yoshida's rigid articulated arm avoids this issue. It preserves the beam coherence from start to finish. Whether you are working at shallow angle or a steep angle in the vestibule, the energy delivery remains consistent. The result is simple: a clean, consistent incision that software cannot compensate for. Handling also plays a critical role in this procedure. Lip repositioning required smooth tracing along the mucogingival junction. If the system feels heavy or resistant, it can affect precision. Some systems may feel cumbersome or introduce resistance. Yoshida articulated arm is designed for balanced, immediate response. This creates what many clinicians describe as a zero inertia field. That means reduced operate fatigue, better hand control, and more accurate translation of movement to tissue. The 2025 study confirms that CO₂ lasers reduce post-operative discomfort. Yoshida builds on this advantage even further. Because of its finer spot size, there is less collateral heat damage, reduced post-operative burning sensation, and less tissue tightness. In addition, cleaner incision margins contribute to faster healing, earlier confidence in smiling, and a more comfortable recovery overall. From a practice perspective, this leads to something very important. Patients who heal better become strong word-of-mouth referrals. In lip repositioning surgery, success is not determined by how easily a laser cut. It is determined by how precisely the beam behaves in a narrow, bleeding surgical field. Yoshida's finer focal spot, stable articulated arm, and highly visible green guiding beam create a level of control that directly protects aesthetic outcomes. Many CO₂ lasers can perform this surgery, but very few allow the clinician to see better, control better, and feel better during the procedure. And that is where Yoshida clearly separates itself. If you find this video helpful, please subscribe to our channel. We regularly share clinical insights, research-based discussions, and practical applications of laser dentistry. Thank you so much for watching. Helping you succeed is what drives us.